Many people have asked me about my own personal spinal routine. So I've had low back pain off and on for 40 years. And I've been going to the chiropractor for 45, 47 years. And I learned spine exercises about 32, 33 years ago. So I've been doing spine exercises for that long since my chiropractor showed me. And of course I've changed them and developed them and come up with a routine that works for my back issue. I'm very fortunate to not have any serious back blowouts where I'm completely crippled. Both my parents had gone through that. Both my older brothers had gone through that. And of course, I've seen it, no kidding now, thousands of times in my chiropractic practice. But I do have off and on backaches, and if I'm not careful, it can get worse. Like a lot of your backs, my lower back does not tolerate sitting or standing in one place for a long period of time. Movement is always better for me. Motion is lotion, right? A lot of you probably fit into that category. Not all of you. Some of you, movement is actually painful, and rest and sitting and so forth is actually better. But a lot of you, you're kind of like me. Being stagnant in one place is a problem. So the spine gets affected by a couple of things down the road. And if we're not taking care of our spine like we take care of our teeth, you're going to have probably more arthritis, more degeneration, more sinking posture, and all the consequences of the nervous system and the brain from a spine that is deteriorating spine, deteriorating brain, right? So I've come up with this routine that I'm going to show you, and as we get into this, remember the disclaimer. Don't do any of these exercises until you check with your doctor. If you're doing any of these exercises, back off, eliminate, check with your doctor, your healthcare provider, your chiropractor, your physical therapist, massage therapist, whoever you're seeing. Please check with them first to make sure these are appropriate. These exercises I'm about to show you are not appropriate for everyone. They're not appropriate for spinal stenosis, severe arthritis, disc herniations in some cases, and so forth. So please get that clearance and be sure first. My routine in the morning takes about 12 minutes. That's what this program is going to be, and you're going to see that. Most people I know won't spend that amount of time. Some do, most won't. But people have asked me, what's your spinal routine look like? This is it. And on top of that, I'm doing stretches throughout the day, in the evening, before bed, and so forth. Not this full routine, but I'll sprinkle them through the day, which I've talked about many, many times on this show, particularly if you have a sit-down job, get up, move, stretch, sprinkle some of the stretches through the day, take your sitting breaks, take them at prescribed times, and so forth. So doing that, we need spine stretches, chiropractic checkups, maintaining posture, thinking about posture when you're driving and you're sitting and so forth. Just spend some time on that. And also spend some time looking at our prior shows on ergonomics, how you're using your body through the day, how you're lifting and bending and driving and sweeping and cooking and all the things that we do, yard work and stuff. Check into that too, because we might be great at spine stretches in the morning, but if we're not really ergonomically paying attention to how we're using our body through the day, those injuries are going to catch up to us. So it's a whole package deal, right? It's like taking care of your teeth. You need to brush in the morning, in the evening, sometimes in the middle of the day, but you have to be flossing, and you have to be using a powered toothbrush, and you need maintenance care at the dentist's office. So there's a package there. There's a package for your spine as well. Here's what I'm doing. It has served me well. It's served thousands of my patients these exercises as well. So let's dig in. Here's my morning spinal routine. The first exercise I start off with is one of the neck extension exercises. Pulling the shoulders down and back, elongated tall spine, head towards the ceiling in a comfortable position. Notice that I spread my toes and my feet, so I'm doing a feet exercise as well. Hold it for about 10 seconds. Then I get right into the spinal twists. Spinal twists, you can start off slow and easy. Don't do a full range of motion if you can't or if it bothers you. And you can work up to a full range of motion. I'm giving you a couple examples here of turning the head with the body, right there, which I don't do. I prefer keeping the head still and just turning the torso. You'll see that one back in a moment. Okay, so I do about 40 twists. 30 to 40 twists each side. This is the way I do it, with turning the torso but leaving the head still. So I have a little bit of post-concussive dizziness and so forth if I'm turning the head too fast. So I like keeping the head still, but notice it's still a counter twist in the neck, which I really like. So take your time, go slow, keep that spine tall. At the end of a bunch of twists, I will do a twist and hold, like you can see here, to really work that range of motion. I throw a couple of those in, holding each one for a couple of seconds at the end of doing those twists. After the twist, I go back and I do another neck extension exercise. So again, shoulders back and down, spine tall, chin up to comfort, hold for a good 10 seconds. This is such an important posture exercise, so I sprinkle them in with the other stretches. Next is a side bend. So same thing here, I might start with a half of a range of motion, then as I move along and do a bunch of these, I do 30 or 40. I go to a more full range of motion. You can see here, again, here's my head still. This is the way that I do it. And I prefer this method, again, keeping my head still, but you can still see it's stretching the neck and getting that counter stretch back and forth. So whatever you choose, you can have the head and neck follow over to the side, or you can hold the head stationary as I'm demonstrating here. Do as many as you like. On my typical videos and recommendations for patients, I have people do 10 per side. I do many more. I find that the more I do, the better off I am. People with more chronic issues in their spine also tend to find that doing more is better. But start slow, take your time, don't push it into the pain zone. This is not lifting weights. This is not a speed exercise. It's gentle stretching and casual. Go casual. Casual is always the word of the day. At the end of the side bends, I'll throw in one where I go all the way over and hold. I'll do a couple of those each side, just holding for a couple of seconds. Great. Another neck extension exercise. Pinching the shoulders down and back, chin up, spine tall, comfortable zone, 10 seconds. So now we've done 3 of the neck extension exercises. We've done the spinal twist, side bend, and neck extension, 3 sitting exercises. Then I head to the floor and I do, of the fuller 5, this is number 4, the knee roll. So notice that the feet stay down, feet stay down. This is not an ab exercise. It is a gentle, casual lower back stretch. Okay. Notice I'm starting with a very slight range of motion, not going that far. And as I start doing more of them, I increase the range of motion slowly. This one is one of my favorites for my lower back. My lower back issue is off and on for 40 years. So this one I always am doing morning, noon, and night. In the morning, I do 50 of them each side. Of course, I took my time building up to them. I'm doing these exercises for 32 years now. So again, if you're new to this and you do get a green light from your doctor, chiropractor, physical therapist, whoever is your medical advisor, start slow, maybe do 10, morning and night. Again, I've built my way up to doing 50 of these in the morning, and I've just simply found the more that I do, the better my back is. Go slow, go casual. I prefer doing them on the floor. You can see here in the studio, I'm doing it on a yoga mat, which I also have at home. And you are welcome to do them in bed. A lot of people will just simply do them in bed to get them done. That's completely fine. I prefer the floor because it's firmer and I feel as though I get a better stretch, but it's your choice. It just make sure you get them done. Get them done. If there's any pain when you go to a full range of motion off to the side, then just simply back off. Don't go full. Particularly if you're in your lower back flare-up, just keep it in the comfortable zone. The comfortable zone and casual. And again, notice I'm not lifting the feet off the floor. Although they are rocking side to side, they're never leaving the floor. I'm not holding the legs up. I'm not holding the feet up. I'm just letting the weight of the legs stretch the lower back gently. Everyone always asks me, can I put one leg over the other and stretch at the end? Sure. If this feels fine, if it's casual, if it's comfortable, you can pop in a couple of those as well. Okay? So I like to do that as well. That is actually beneficial for my lower back. And if it is for yours, just, again, proceed with caution. Listen to your body. If you like it, do it. If you don't, eliminate. 5th one of the fuller 5 is knees to chest. You can throw in a couple of these. I just do a couple of them. Pull the knee up to the chest and hold. Couple on both sides. That's all I do. You can do many more of them if you really like them. Now, you can also pull from underneath the knee. If you have sensitive knees like I do, you can pull from underneath, and that will take a little pressure off the kneecap and prevent the knee from bending fully. You can also pull both knees up to chest and hold. This is a wonderful one for my back. Many of you are probably already doing this one. You can hold that as long as you want, 2, 5, 10, 20, 30 seconds. You can also use the grip underneath the knees to remove a little bit of knee sensitivity. Great stretch for the back. That's the Fuller 5. Now here's my version of pike. I like this pike exercise, and then I throw in some hip stretches. So you notice that I'm working my feet in different positions. I've just found that this is such a great hamstring stretch, calf stretch. It's gentle, it's comfortable. Who doesn't benefit from the adductor muscles in between the legs and stretching those out? So I throw in a few of these. I'm already in that position. Why not? Then here's my version of pike. I like this one because the lower back is flexed. It's a nice little ab exercise. Again, only do this if it is comfortable, if you get a green light from your medical provider to do something like this. But that's always been comfortable and good for my lower back. So I like that version of pike. I like to throw in a couple of these. Cat stretch. Now you're going to notice I do cat to neutral. I do not do cat to cow. I don't let my belly sink to the floor. And then I go right into child's pose or prayer pose. So you'll see me alternate between these two a few times. Back to neutral, arch the back like a cat and hold. I contract my abs a little bit for a nice stretch in the lower back. And then I'll relax that, sink right back into child's pose or prayer pose. Again, a lot of you know this one. A lot of you are doing it. I just make sure I throw in a couple of those each morning. Cat and neutral, and then child's pose. Okay, tall wall. This is a great one. I do one of these in the morning. I'll hold it for 30 seconds. I'm going to go for a little bit longer. Just remember the cues. Your heels, if you can do this, heels, rear end, shoulders, back of the head are against the wall. Get that spine as tall as you possibly can, stretching to the ceiling. But then your shoulders and your arms and your hands go down to the floor. So the spine and head go up. The shoulders and arms stretch down to the floor. They go in opposite, opposing directions. Contract the ab muscles a little bit, do a pelvic tilt, so you're trying to flatten the lower back against the wall, and then hold. And as you do it, check in to all of those cues that I just gave you. Here's the lower back pulley. I've been doing this for about 20 years. Some of my patients have benefited greatly to this. This has always been part of my morning routine. I might do 30 or 60 seconds of this, okay? So I have the pulley system attached securely to a doorknob, and I love to start with the pumps here. At the top, you're going to see I'm going to do a couple of different positions in a moment, but this is just fantastic for certain lower back conditions. Some people love this, some people don't. And you kind of know if you do. If you're a person that likes the cat stretch and child's pose, and that's great for your lower back, something like this can be really great. So now you can see I'm really getting that stretch in there now. So my arms are going straight to the floor. It's lifting my pelvis off the floor and getting a great stretch and opening up the posterior elements of the lower back, opening up the posterior part of the discs. The joints of the lower back, the facet joints are being opened up like this. Great stretch. It's kind of like a cheap way of doing decompression, if you will. It's not as intense and thorough as a decompression table, but boy, for a lot of people, this is a great home alternative. Then I get the lower thoracic spine here at the end by letting the spine sink on the floor. You can see that took, 45 seconds or a minute, but I add that every day. That is such a great stretch, those pulleys, okay? I sometimes will take a break just to let everything stretch out because that is a bit of a compressed position, and then I'll go back and do some more repetitions. So I'll split the pulley up into two sets, if you will, and then I'll go back and do a handful like this. And the different positions work fine. Again, this is just a casual stretch. It's not a core exercise, ab exercise. That's not the purpose of it. This one is just opening up those discs and joints, decompressing the spine, and there we go. So inversion is not for everybody. Do not do inversion. Absolutely do not do this unless you check with your doctor. I've been doing it off and on for 25 years. This is a great device because I'm bent 90-90, about 90-90. Bent at the hips, bent at the knees. The only disadvantage of this kind of inversion table
is you have one position and that's completely upside down. A lot of the inversion tables that you know hang you from your ankles and your body is straight on a cot-like device. And that's good. A lot of people respond really well to that. This is a different method. Not everyone tolerates being upside down, that is for sure. This one you definitely have to check with your doctor. If you have any blood pressure problems, vertigo problems, circulation issues, heart problems, anything like that, that's all contraindicated here for sure. You can see I'm doing just a couple of little ab exercises here, just a few slight crunches, very, very small range of motion while I'm doing this. But pretty much I hang in anywhere 30 to 60 seconds, maybe a little bit longer at times, but yeah, 30 to 60 seconds works for me. And notice I do the inversion toward the end of my spinal stretch routine. I do all the other stuff first to kind of get the spine warmed up and moving. And I find the inversion toward the end of the different stretches that I'm doing is a much better way to go. So getting the spine prepared for each of the events coming up. So I'll do the fuller 5 first and all the others, and then I do the pulley, and then I do the inversion. I come out of that slowly. I take a break to make sure that I'm not uncomfortable coming out of that. And that's my morning routine. That's what it looks like.
So that's my spinal routine. That's something that has served me well, along with all the great care that I do. I still go to the chiropractor once a week. I do my spine stretches every day. I sprinkle some through the day, as that I mentioned. I try to practice really good, as best I can, ergonomic habits of how I use my body during the day. And hopefully this package will reduce suffering for a lot of you, which it has done for me and my family and thousands of my patients and all the people now around the world. I'm getting information from around the world, the people that watch this show, and they get some great tips on how to take care of themselves. So we wish you well. Leave us comments. Let us know if you want more shows like this. I'm Dr. Scott Fuller.